evening, everybody. I am so excited to be with you tonight and with none other than Liz Lundry, my longtime friend and brilliant educator. I am Debbie Duraco. I am the Senior Director of Stella Life, and you are really in for a treat tonight. Liz comes to us as a practicing dental hygienist since 1979. She has been an office trainer since 1988 and earned her laser certification in 2000. As a consultant with the JP Institute, she works with dental practices all over North America, providing hands-on technology training, including lasers, air polishers, ultrasonics, integration of nutrition, customized in-office coaching, and rigorous postgraduate seminars and workshops. I'll tell you, she's a lot easier than rigorous. She teaches you a lot. She is a published author and a veteran clinician. As a speaker, she's presented at international seminars, national study clubs, and state meetings. Liz is the clinical education manager for Stella Life and the host of the Stella Life Innovator Series podcast. While Liz is presenting, please mute your phones or your computers and place any questions that you have in the chat. We'll address those at the end of the seminar tonight. So it is with the most pleasure I would love to introduce you to none other than Liz Lundry. Liz, welcome so much, and thank you so much for spending time with us tonight.
Thank you, Debbie. Thank you for that wonderful introduction. I feel so great. Thank you. And I want to thank all of you for joining us today. I know you're really busy, and I'm here to share a few things that I've learned through the years and hope to give you information to inspire you and help you carry on, with the journey that we are doing as clinicians. So as we look at who I am, as Debbie has mentioned, I am the senior consultant at the JP Institute and the clinical education manager at Stella Life. And so today, what I'm going to be sharing with you is information about the oral systemic link and how that affects patients' bodies. I know that this is an area that we've been learning more and more about over the last couple of decades. And as a trainer with the JP Institute, our founder, Jan Lazarus, she is a hygienist, and she was talking about the host modulated response back in the 1980s. So as a JP trainer, we've been teaching and talking about the oral systemic link for decades, like before it was a thing, because we saw how people would heal differently and how their health was affected by having periodontal disease and really putting that together. So today I'll be talking a bit about that, of course, as well as how we can have effective techniques to reduce implant failures. So we're all in this together, clinicians, hygienists, assistants, doctors, admin teams, all of us, in helping our patients have the best implant experience and the best chance of maintaining a long life with that implant. So nothing lasts forever in dentistry, and with implants we're talking about a shelf life of about 30 years. So if we have a young patient getting an implant, we want to, well, for everybody, we want to maintain the health of that implant as long as we possibly can. So there are a lot of things that we can do in the preparation phase of before somebody has that surgery, which I'll be talking about today. So I'll be sharing the best ways that we can accurately diagnose the presence of periodontal disease, and then what types of technologies we can use to really be effective. I mean, when I first started as a hygienist in 1979, we didn't wear gloves or masks. The only ultrasonic technology we had were the big P10 tips to use for supragingival calculus removal and staining. So there's been a lot of evolution of that technology, and it continues to evolve. So we really need to stay on top of it, because we are all going to be dealing with this very delicate situation of implants and needing to use the right equipment so we don't damage them. So we want to be effective against that biofilm, again, keeping in mind the systemic response that the patients has and how each of them have different conditions and different risk factors. And what can we do to help supplement our patients to make sure that they have a healthy oral microbiome, a healthy gut microbiome, and they have the nutritional needs there satisfied so they can heal really well. So the JP Institute, as Debbie mentioned, we've been around for a really long time and has always been on the cutting edge. And the protocol that Jan Lazarus developed as a clinician, the patients that she was treating would heal way better and stay in remission way longer because of the protocol that she established based on the science of the time. And now that the research has developed, we really see why what she has been doing is effective and why we teach these concepts to our clients. So I'm going to give you that in a nutshell so we can use that information when we're treating our patients as well. So when you implement this type of a protocol in your practice, you see changes in the clinical care and obviously the practice growth as well. When we do everything for our patients that they need, you're going to see practice growth as well. So our philosophy at JP is to treat periodontal disease in the very earliest stages. So back in the day, the first symptoms that we would see would be bleeding tissue. Now we know more about how there is actually a presence of pathogenic bacteria long before we see these first initial signs. But the earlier we can treat them, and then we need to keep our patients returning at an interval so we can really keep them in remission. So if you look at the pie charts here, most offices that I work with are somewhere in this area where they're mostly doing prophies and doing some scaling and root planing and maintenance. But as they really fully implement this, this is what our target is, where your patients have been treated, probably 50% or more are in active maintenance. And then they do fall out of remission occasionally, so they will get retreated as needed. And then you'll have new patients coming in. So we can have a model where we have patients in the perio maintenance. We're going to be seeing about 32% of our patients in active therapy, and then only about 17% would be the prophy patients, because the prophylaxis is a preventative appointment for someone who has no disease present. So we do this by educating the team, and it's really a matter of us redefining our role and changing that conversation we have with the patients. So if we can give them some educational information every time we see them, whether we're doctors or hygienists or assistants, we're really able to help them have a greater understanding of who we are, what we're doing for them, and stop just talking about teeth. We can and need to integrate information about how their oral health affects their body. More and more people are aware of that these days, but many people still don't know. So it's up to us as educators to let them know about that. And then we want to make sure that we do treat disease early in that detection. So this is basically, in a nutshell, the JP approach. And this is the platform that I'll be using for what we should be doing for our patients as we prepare them to have implants placed and then keep them healthy so they can have a long life with those implants. So we're talking about an individualized treatment plan, not using a cookie cutter approach where if somebody has pocketing or bleeding, we give them 4 quads of root planing and then see them 3 months later and we're done. It really is a matter of looking at people's risk factors and creating an individualized treatment plan dependent on those risk factors. And because we cannot predict how anybody heals, our treatment plans are open-ended, and we present it that way to the patient so they understand that we don't know how they're going to heal. We estimate they'll need X number of appointments. We would like to give them a range for how many therapeutic appointments they'll need. And the concept of repetitive therapy is something that Jan Lazarus did originate. It has since been adopted by many clinicians and many instructors because it's very effective. Where again, instead of treating our patients in hygiene by quadrants, upper right, upper left, lower left, for everybody, we treat disease where it's most apparent, where there is the most infection first, wherever that may be. And we know that, and the patient returns at a 10 to 14 day interval so we can have some healing happen and evaluate that. And we retreat the areas treated at previous appointments and then add new areas, again, depending on the level of infection. And we work our way through them out this way so that we can really provide the most repetitive treatment in the areas that need it the most. And our treatment is all encompassing, using whatever technology you have available in your practices. And we do want to use salivary diagnostics. We can look at patients' nutrition, give them some help with their lifestyle choices, because it's really about looking at the whole patient holistically to help them heal and to stay healthy. And then we need to see them on an interval that's going to keep them in remission so we can really closely monitor them. So as we look at implants and how we're going to be placing these for our patients, I have set this presentation up in steps. So we have a preparatory phase and then what happens post-operatively with our patients. So first of all, we do a risk assessment. I know you're doing that. And with the research that's out there, we have your basic conditions that we see with so many people. And we've got metabolic syndrome. We have a lot of obesity. That's chronic inflammation. So many diabetics, more and more, and they're getting younger, it seems, year after year. So with diabetics, if they have controlled diabetes, then their implant failure rate really isn't any different from somebody who's a non-diabetic, but there is always that susceptibility there. And if they are out of control, then it's going to be a problem. Again, smokers, we know they have up to a 200% failure rate. So anybody who is a smoker, it is an issue, bone integration, and then maintenance of that healthy bone around those implants. Though I have had smokers as patients who I've seen for decades, and some of them do very, very well. So we just need to support them and monitor them closely. And then patients with periodontal disease. This is really where the biggest challenge remains. And I've been listening to some of Gordon Christensen's podcasts recently and in a discussion about implant failures, particularly, and periodontal disease is really the number one cause. I mean, there are so many factors. You're talking about occlusion. We can talk about so many different issues that are there, which I will be discussing today. But the presence of periodontal pathogens seems to be number one. So we want to be aware of any chronic inflammatory conditions as well. So the risk factors are the innate ones that our patients are born with. With genetics, you know, it's been a mystery in the past, but we can actually do, using salivary diagnostics, check out some things about the patient's genetics to see if they are more susceptible to an exaggerated inflammatory response, which means that we would treat them differently and have them on a very, very closely monitored system. And those acquired risk factors, such as smoking, heart disease, so many diseases are preventable. They are caused by lifestyle. And again, as healthcare providers, we can help our patients understand that, including their diet, you know, which the American diet isn't such a great diet. So we can see that result with the people that we see around us and our patients. And then the stress that we all have to go through and lack of sleep. These are all things that have a huge impact on our immune system and is going to slow down and possibly even prevent total healing. So we want to do that assessment of their periodontal condition, because if they do have it, we're talking about up to a 200% increase in implant failure. So how common is periodontal disease? Well, if you look at the statistics, you'll see different numbers. But the question I always ask my doctors and hygienists and all clinicians is, how many patients as a hygienist are you able to clean their teeth and there's no bleeding? And as a doctor, and with assistants as well, how often do you do a crown prep on a patient and see no bleeding? And generally people kind of roll their eyes and say, well, like, everybody's bleeding. It's so common. We've become sort of complacent about it, say, wow, they've all got it. What can we do? But we can do a lot, but that is really how widespread periodontal disease is. And you know that because we see that every day in our practices. So you may have seen the schematic from the Scientific American in the past, but I love this because it shows the culprit here, the bacterial colony, the biofilm colony, that as soon as we get done with our hygiene procedures, it starts growing back. So it's a matter of keeping people in remission. When the bacteria are single-celled planktonic bacteria, very easy to eradicate them with rinses, anything else. But once they become organized and form this biofilm colony, after a number of weeks, they communicate with each other throughout that time through quorum sensing gene regulation and are very organized about this community that they build. And once it gets into the later stages, this colony is protected by a mucopolysaccharide matrix, which makes this now impenetrable to any chemicals. You can't kill this bacteria with any type of rinse at that point. You really need the technology to be able to break that up, because hand instruments aren't going to do it. So we really need to use our ultrasonics, our air polishers, our lasers, whatever we have available. So here is P. gingivalis, keystone pathogen linked with so many diseases of the body as it's being engulfed into a cell by phagocytosis. So once these bacteria are there, we know they enter our bloodstream and they cause not only a localized infection, but there is the systemic response because of the inflammatory cascade that is triggered by the presence of these pathogens. So periodontal disease is a systemic disease. And when we look at these statistics too, they can be pretty scary. So 95% of Americans with diabetes also have perio. There's that two-way relationship. Diabetics are more susceptible to perio. And then patients that have diabetes as a risk factor in their family, as they develop periodontal disease, that also increases the risk of diabetes. So it's a two-way relationship there. So the risk with dementia, with Alzheimer's, cancers, the cardiovascular diseases. So the list goes on. And we're looking at 80% in this statistic here of patients having periodontal disease. But again, we've seen the bleeding. We know so many people have it. And this one was interesting too, when I learned about this, how just having the saliva transmitted to the eye can actually increase the risk of glaucoma and macular degeneration. So again, very dangerous pathogens that do shorten our lives. So as we're trying to assess periodontal disease, we've relied on probing. That's the technology we've always had available, but is it really enough? So when we look at the perio probe, it's actually 1936 technology. In the podcast series that Debbie mentioned, the Innovator series, I had the pleasure of interviewing Dr. Tom Neighbors, who established oral DNA and now founded Direct Diagnostics. And we had a conversation about the fact that the periodontal probe is 1936 technology, and we've been relying this for diagnosing periodontal disease. So we look at pockets, we look at bleeding, right? But we know that we can have shallow pockets. This is a 2-millimeter pocket, as you can see here. But when you actually pass the probe through the tissues very passively, you can see this bleeding. So clearly, even though this patient has shallow pocketing, there is a disease process going on here. So there is an active infection. So the best thing that we can do is utilize the technology that is available now to test for pathogens. And my colleague, Laura Hooper, who was with Direct Diagnostics and is now working with the Prevent Clinic. And she is absolutely an amazing clinician and a wonderful speaker. So if you ever have a chance to hear her, she's now the Vice President Clinical Director for the Integrative Dental Medicine Scholars Society, as well as the coordinator for the Prevent Clinic with Dr. Gina Pritchard. So she's very well respected and has shared these slides. But there are more and more of these organizations that are offering salivary diagnostics, and it's very, very affordable. And as I'm sharing these different concepts with you, I have the opportunity to go to a lot of continuing education courses. I love to sit in on these lectures, and I learn a lot from these doctors placing implants, doing all types of surgeries. And when I go to these courses, I will talk to the attendees and I'll ask them questions like, are you doing salivary diagnostics in your offices? And I'm talking to not just general dentists, but also periodontists and oral surgeons. And really, most of them are saying no, or they're saying, yeah, we'd use it sometimes. So this is something that we have available to us, and it really makes a huge difference, especially as we're prepping our patients to have an implant. Because if they have any bacteria present, they have a disease, it's going to impact the life of that implant. So with the salivary testing, we can identify the bacteria that is causing their disease. And we also will get guidelines of antibiotics if needed or other recommendations of products to use. And what's great about doing a lab test is we can share that with the patient. So the patients are used to getting lab tests, right? If they possibly have strep throat, they get a test, they know they have it, they get the treatment, they get the prescription for what they need. So if we're talking about a bacterial infection, I know as I would talk to my patients, and I hear this from other clinicians telling them that the periodontal disease they have is caused by bacteria, they will often say, well, can't you just give me an antibiotic? Well, sometimes we can, but we explain to them we need to know which antibiotic to give them, if any are necessary, and that's why we do the testing. So this actually helps us get better case acceptance as well. So that's really the value of doing this for our own information, and the tests that we can do now are getting to give us many, many more options. So we can test not just for the pathogens that are causing their disease, but we can check for the patient's genetic susceptibility, what their inflammatory response is like. And different organizations have testing for fungi, they test for caries, COVID-19, HPV. There are many and more tests being available. So you should definitely look into that. What happens with so many patients that we may see, they look like they're pretty healthy, but they actually do have an infestation of bacteria, but we haven't seen any of the obvious symptoms yet, such as the bleeding. It can be subclinical. So again, we don't see the disease presence a lot. Here's an example of a patient who basically has 2 and 3 millimeter pockets. You can see how tight this tissue is. You can also see that there is a lot of attachment loss there. And so this patient had no bleeding, again, very shallow pockets. Everything appeared to be healthy, just thin phenotype, a lot of attachment loss. That patient is me. So this was my oral DNA test taken at that time. And you can see how healthy that tissue looked. But look, I had Tannerella above threshold. So I was, again, given the protocol of using metronidazole to treat this. And as a hygienist, my hygiene, I mean, I'm using water picks, I'm using floss threaders, I'm using everything you can think of for my daily hygiene. I look after myself by taking supplements, I do exercise, all things we're supposed to do, and yet I had this above threshold. So that was really an eye-opener to me. And this is what we're dealing with our patients. So using this technology, we can find out what's happening before we move ahead and place an implant to give them the best chance of having a great outcome with that. We can also test the patient's own DNA. We can test with the MyPerioID test with oral DNA, and other organizations also have similar tests to actually check for the patient's genotype. So there are a number of patients, probably around 30% of the population, that have an exaggerated inflammatory response because of the interleukins here. So this tests for the IL-1A and 1B interleukins so that we can see if this patient is going to have an exaggerated inflammatory response, regardless of their pocket depths or what's happening with them with the pathogens. So knowing this, and if the patient knows this, they will understand why they need to come in more often for their maintenance. And this can be, again, applied to all your patients, not just the patients that are going to go through implants. But once they see these results, a lot of these patients, these are the ones that you see them, they do everything they're supposed to and you believe them, they see you often, but they still always exhibit some bleeding, because with these patients, even a small amount of a fairly innocuous pathogen is going to give a much more of an exaggerated response. So we want to make sure we know about this and the patient is aware of this too. So I can't overstress the value of getting this information to really treat our patients to completion. So with the growth of the biofilm, it is very organized. Again, they communicate with each other through chemical signals, tell each other what to do and where to go as this grows. And again, P. gingivalis is a major player. So if we can get this one under control, we can help our patients not only have a healthier mouth, but also a healthier body. So after treatment, this is from Direct Diagnostics, using their protocol and using the antibiotics that may be recommended, we're able to get our patients under control as far as their periodontal disease is concerned. So that would be number one, because that is the greatest reason that we see implant failure. So I'll be talking about implant maintenance in just a little bit. The next thing we really need to be looking at is the patient's vitamin D level. And we know that so many people are deficient. And if they are, we're talking about up to 3%, 300% increase in implant failure if they're deficient. So how do we find this out? We can request that they bring a lab test from their doctors. They can go ahead and request that and get that done on their own, or we can provide an in-office test for them. And there's a trend to more offices doing that, but we should be able to get that from their physicians. We are seeing that so many people are deficient. I don't know if you remember, about over 10 years ago, the American Medical Association recognized how many people were deficient, so they increased the recommended daily dose of vitamin D. And if you remember at that time, I remember all these patients, when I would take their health histories, would say, oh, I'm taking vitamin D. Oh, I'm taking vitamin D. It was like this thing. All of a sudden, everybody was taking it because the physicians recognized this. And, we still have this issue. Patients are still deficient. We don't get enough sun. We don't eat the right foods. We do so many things wrong, that don't help us. And then you have the people that have other issues that will cause them to be more susceptible. So making sure that they have the nutrients there so you can get the best possible bone integration is hugely important. And so there's a lot of research on this. You can see a lot of these articles on stellalife.com, and you can explore this on your own. But we do have a solution for this with Stellalife Dentamedica. So with these supplements, they are fully absorbed. I've been taking supplements for a very long time and doing a lot of research into supplements for decades. And many of them don't get absorbed at all. They actually pass through the system. The Dentamedica supplements have been tested for the antioxidants that are there, and also for the vitamin D absorption, which I'll talk about in just a bit. But as far as testing in the office, you can get a test 4D. These are in-office tests that can be done chairside. You can get this kit actually from Dr. Rick Myron's bio-prf.com website. So as you use the kit and you need to get the refills, then you can order the tests themselves so that you can test the patient's chairside if you would like to, or again, you can get it from a lab. But with the Dentamedica, we're able to really support the patients nutritionally, again, because our diets are hugely compromised. So we want to make sure that they have all of the essential nutrients, including the vitamin K and the vitamin D. So again, with the absorption, the antioxidants that are here have been tested for absorption with a biophotonic scanner. And we've also tested for the vitamin D uptake with a post vitamin taking tests, so we can actually test that the vitamin D levels have gone up after the Dentamedica has been taken. So it has everything the patients need. And if it's something that you want to implement in your practice, we do provide training with Stellalife for your team with all of our products, so we can help you with that and implement it properly. You should just test for the vitamin D with the patients. If they're deficient, then you can put them on this. We need to make sure they discontinue other supplements, and this is something that we can help you with. So once we've established their vitamin D levels and we're helping them to supplement that, we can treat their periodontal disease, providing, again, full mouth disinfection. We need to treat that infection to reduce that implant failure rate. And we use Stellalife as part of that protocol as well. So with Stellalife Vega Oral Care, we have a natural alternative to chlorhexidine, our recovery kit that is used for surgeries. It's also used in hygiene for patients that may have difficulty healing, diabetics, as they're going in to have SRPs done, or periodontal therapy, as we refer to with the JP protocol, non-surgical periodontal therapy. The use of the recovery kit is wonderful. So using the kit before a surgery, the patient uses these 3 products: a rinse, a sublingual spray, and a gel. All 3 products, one after the other, 3 times a day, ideally starting 3 days before the surgery. When that is done, when they come to you for the procedure, you're going to have a clearer field. There'll be less bleeding. the patient is already going to have a disinfected mouth. You're also going to have a reduction of inflammation and even helps to reduce anxiety for the patients. But most importantly, it's going to give that patient a comfortable experience because there will be analgesia in place. You can reduce any pain medication that you give them, particularly the opioids. And we're also able to have the patients use this 3 times a day, 3 days before the procedure. They do the same thing the day of the procedure, all 3 products 3 times that day, and for 7 to 10 days afterwards. So this is going to make a huge difference in the level of comfort and also to accelerate their healing. So I'll be sharing some studies about that in just a bit. So why not use chlorhexidine? I used it for a long time as a hygienist, but we've learned about the toxicity of it. And particularly with implants, we know that with the chlorhexidine, it is going to change the surface of that implant. So it is linked with corrosion and other issues. And it also will make that surface hydrophobic. So again, should not be exposing implants to chlorhexidine. I know that sometimes I've heard about doctors actually even putting implants in chlorhexidine before placing them. So it does alter the physiochemistry and the cytocompatibility of a titanium surface. And again, can increase the susceptibility to corrosion and lowers that pH. So again, avoiding that would be best. This is one of some of the university studies that we've had done for Stella Life. This University of Texas study really compared the Stella Life rinse to chlorhexidine, to Listerine, and to saline, finding toxicity with those other rinses, no toxicity with Stella Life, but also proved that the Stella Life rinse actually accelerates the growth of fibroblasts. So you can see that in the slide with the Stella Life sample. Here's the fibroblast growth as compared to the chlorhexidine sample, which chlorhexidine we know kills fibroblasts as well as osteoblasts. Last thing you want to do with an implant is do that. And then this is the control here, but you can see how much more fibroblast activity is with the Stella Life exposure. And the Stella Life gel also accelerates fibroblast growth. So again, when you compare Stella Life to the chlorhexidine, there's no comparison because of the issues with the toxicity. And then we want to accelerate the healing, not impede the healing as we do with chlorhexidine. So as we're maintaining implants, I really want to recommend that everybody have this book in their office. Definitely every hygienist should have this, but if you're whether you're placing implants or not, we're going to see more and more patients coming in with implants, and we need to know what to do. So this is a terrific book. You can get it on Amazon. Susan Wingrove is incredible. This is all science-based. So it tells you what to use, what not to use, what can be harmful, and what's going to be most beneficial for your implant patients. So one of the things that she talks about is air polishers. So we're not talking about the old Profi jets that are using the sodium bicarbonate that is harmful, and she talks about that in the book. But using an air polisher such as the EMS, the airflow prophylaxis powder is made of erythritol, so it's a very small particle size, and it is not harmful to implants at all, but it does kill 100% of the biofilm. So you can use the supragingival scaler, which actually the supragingival air polisher that actually has up to a 5 millimeter reach subgingivally. So it can be used for maintenance for all your patients. And if they have pockets, you can actually use the PerioFlow. And this gets inserted into a pocket for 5 seconds and will kill all the biofilm. So great for treatment of periimplantitis and also to help with prevention of that happening. And there are other companies that have wonderful products also that provide the air polisher option. So this is something that you may consider investing in if you don't have one already, because it's really the best way to maintain these implants. So with lasers, I do work with lasers and have done for decades, and the lasers are wonderful. You can be very effective at killing this bacteria, really handling the biofilm using the light. And you can use a cold laser, so a laser that's not initiated on a pulsed wave. So you can use that around implants. If you're using a diode laser, it does not interact with the implant surface. But at least using it to decontaminate these pockets, you can use the lasers at every hygiene appointment so that we can reduce the download of those pathogens. And once somebody has an infection, actually using an initiated tip, if that's allowed in your state by the hygienist, then you're able to remove infected tissue selectively, and you're going to be able to always stimulate the mitochondria with the laser, so that we can get that growth happening. It seals the lymphatics and the blood vessels, so the body doesn't actually recognize it as a wound site, as opposed to just using a curette or any other type of like scalpel or something. The laser is much better for that. And we can help to not, the body will not recognize it as an injury. So the inflammatory response is going to be reduced for a few days when the laser is used. So we're able to really get much better clinical results. And because we're doing a much more effective job with the killing of the biofilm, we're able to have just a better result with keeping patients in remission for longer if we use the lasers on an ongoing basis. So here, this is an initiated tip being used to remove infected tissue. So if you are placing implants, you may consider also having the Millennium laser there, or a laser, an Nd:YAG laser. The Millennium is actually certified by the FDA to be used for LANAP and for LAPIP. So it's a really great way, and they've actually shown much regeneration of bone with the laser itself around implants and other types of periodontal patients. So they provide training and are very, very helpful. But there are a lot of different laser products out there. And most commonly, I see diode lasers being used in offices. And again, with the hygienist using that, very effective to reduce the bacteria. And again, cold laser can be used with a diode pointed at the implant, but hopefully we're not dealing with the threats of the implant, though we will see more and more of that through the years as more patients get implants. We're hopefully working on the prosthetic and possibly not be on the abutment. That's what the hope is. But having this technology is going to go a long way to being more effective against this bacteria. So we'll have our patients come in for non-surgical periodontal therapy, including scaling and root planing. We can certainly use the Stella Life rinse for irrigation. So that's a great adjunct to do at the end of the treatment. If you use a laser, you can still do that. Just use an endosyringe for that. And putting the gel on top is going to help, again, reduce inflammation, help that patient have a better experience and feel more comfortable post-operatively. So it's a great partner to have with the other products that you use, as far as helping the patient with the other technologies you have to get the best response and have them heal very, very quickly and be very comfortable. So the Stella Life rinses are effective against these pathogens, including P. gingivalis and strep mutans. So using this as a daily rinse is terrific. It will keep your patients in remission. It's great if patients have xerostomia with one product, they can reduce their caries risk as well, their hydrate. So these products are meant and can be used on a daily basis, ongoing, to keep everybody healthy. And what we're trying to do here is really establish a healthy oral microbiome and a healthy gut or healthy gut microbiome as well. But with the oral microbiome, we disinfect. We use our technology, we use our lasers, our air polishers, we can use our Stella Life rinse as well, but we want to repopulate with good commensal bacteria. So we have our Stella Life pre and post and probiotics kit. So in one kit, we have the gut probiotic, and we also have an oral probiotic. So the oral probiotic, there's a real trend to using these so that we can establish a nice, healthy oral microbiome. So this is the purpose of this. The oral lozenge is also available as a standalone product, but we very carefully selected these species that have very specific functions to really ensure that we have the best combination of these to have a healthy gut microbiome. So important if we're going to be giving our patients antibiotics, because that's pretty much going to wipe out all those good bacteria that they need to have in the gut, and it's going to affect the oral microbiome as well. So by giving our patients this and having it available, just like with the Stella Life products, as a bundle to give to your patients as they're contemplating, as they're preparing to have implant placement, is going to go a long way to helping you have the best possible outcomes. So this is what is recommended. So another thing I want to really suggest everybody does, and I hope you are doing it, is with your imaging, using a CBCT, to get that 3D imaging for implant placement. So that was another thing that Dr. Christensen was talking about on this podcast with his colleagues, just saying you really need to have this 3D imaging. And he said, just go ahead and get a CBCT, just go ahead and buy one. But you can also send somebody out to a lab to get that. But it's so incredibly important to have that. And as far as lawsuits go, I mean, we don't want to worry as much about that as just doing the right thing for the patient. That's why we want to have this technology. That's why we want to have the CBT being done, the CBCT scan. But has become an issue with lawsuits where implants placed without that, it's been like just an easy lawsuit. So we see more and more of it, and we want to make sure that that doesn't happen. So protecting yourselves, but most importantly, making sure that we can be most effective with that placement, knowing where to go with the scan that's done. So highly recommend it. And I'm hoping that everybody is doing that. So as we are getting to the day of the surgery, here's one thing that I learned from attending a surgical course with Dr. Jin Kim. And he was talking about the need to disinfect the patient's face. This is another question that I've been routinely asking my doctors as I go to these different conferences is, are you disinfecting the patient's face? And most people are saying no, that they really aren't. Some are. And there are different things that you can do. Dr. Kim's saying, yeah, if you still have some chlorhexidine there, you can use that to disinfect the face. Just like before you have any kind of a surgery, you are asked to take that chlorhexidine wipe down like the night before, and then the day of the surgery, and then they do it again before they actually do the surgery when you're having any type of surgical procedure done in a hospital setting. So we really need to do that for our implant patients or for any surgery as well. One of the reasons implants fail is because the bacteria from the face has been transmitted to that implant site. So again, having that done, and you can also use povidone iodine or isopropyl alcohol diluted to 60 to 80% to make sure there aren't any pathogens being transmitted from the patient's face. So it's easy to do, it's not expensive, and it can make a huge difference for you if you're not already doing that. So I really wanted to share that with you. So what is suggested when you're using any products in your practice or any services, rather than having a fee for the procedure and then a fee for the Stella Life and then a fee for a test or whatever else you're going to give them, you should create a bundle that will include everything, including your CBCT scan, anything else that you're incorporating into the practice, into the procedure. Just have that all in that bundle. And then the patient will get one fee, and they'll have their portion. They're probably not going to get a lot of insurance assistance with an implant, right? And so a lot of doctors that I have working with actually would call insurance a coupon. So particularly if somebody is having like an all-on-X case, you're doing a full arch procedure, then we want to just have one fee included, everything in that bundle, for that patient, so they can make it very easy for them to understand. And then things are not optional. It's just, this is the way that we provide this procedure for you so that you get the best results. So we give you the Stella Life recovery kit so you heal quicker and you'll be more comfortable during the procedure. And that's how we present this to the patients. And again, they get the one fee. So that's the best way to proceed. So once they've had their surgery, so again, if they're using that recovery kit, they will start that 3 days before, 3 products used 3 times a day. They'll use the same 3 products the day of the surgery. Again, if you don't want them to swish, they can do a head roll or just hold the rinse around the surgical site, get the area disinfected, get those fibroblasts growing and really accelerating that healing. I've had 2 perio surgeries myself, and did use the recovery kit each time. It was great because I had massive bone grafting. You saw my before picture there. Since I had that image taken, I've had orthodontics, I've had SFOT, massive grafting on the maxilla, root coverage, free gingival grafting on the mandible. So my palate was a donor site twice, and the recovery kit was awesome because it cleansed those areas. It was very soothing to rinse for 2 minutes with that rinse, and then using the sublingual spray to get all of those elements into the bloodstream, and then using the gel. Anytime I felt any discomfort, I just went to my recovery kit and was able to really not have to take any opioids at all, just the acetaminophen and the ibuprofen for a couple of days. That was all I needed. So post-care, they will use that kit for 7 to 10 days after the surgery, and they should stay on a very tight leash as far as maintenance goes. So we know that the 6-month interval for prophies, for cleanings, is not based on science. It comes from the 1950s. It comes from a TV commercial, basically. So there's no science there. The science is showing that we should see our patients closer to about a 3-month interval, because that is the life cycle of that biofilm colony. Once you're getting closer, somewhere around 9 to 12 weeks, that colony is very complete. It's doing all the damage that it does. And it's, again, affecting our overall health, not just our oral health. So keeping our patients on the interval that works best for them is what we aim to do. So with the JP protocol, we look at their risk factors. So patients that are diabetics, maybe 12 weeks is too long for them to go. So you do that case by case, make a decision of how often they should be seen when they come in. If they're looking good, we can maybe extend it by a week, but we'll get to a point as we do that where we see that patients are now starting to fall out of remission. And if that should happen, we know we can pull them back by a week or two. And that's how you found the interval that works for that particular patient to keep them healthy long term. So also, because this bacteria does grow back, having them use something for daily disinfection that is non-toxic, that's pleasant to use. They can definitely use the Stellite peppermint or coconut rinse for that. And then it is recommended to retest for pathogens on an annual basis. So when we do that, we can do another saliva test. We can just do the one testing for the perio-pathogens. The genetic test is done once in a lifetime. Their DNA doesn't change, but we can't retest for the pathogens as they may come back. And if they do, then we take them through the treatment cycle again. But without the testing, we really don't know if those pathogens are there. So as far as the home care goes, we want to keep things very simple, hence the KISS principle. And I think the best product for everybody, particularly for implants, is to use a water pick, use some type of a water flosser. I really love the water pick Sonic Fusion. So you have the sonic brush and you have the water flosser all in one. The patients can do both at the same time. Anything that makes it easier and take less time is a big win for the patients. So I recommend this. It feels wonderful. And the thing with the water picks or any oral irrigator that uses this type of technology, the benefits is not so much the power washing. What happens is the water pick creates what's called the Venturi effect, as the water with a pulsating jet, because there's a piston in there causing a pulsating jet, as it goes across the surface, it actually creates a negative pressure. It creates a vacuum. So studies have shown that it actually removes the biofilm that you can't reach with floss. Floss is great for hopefully preventing interproximal caries, but it is really ineffective subgingivally. So we really should look at something else, and this water pick fusion is a great way to go, particularly with implants, because they really can't access those areas any other way. So for daily disinfection, when we look at what's available out there, is it effective? Is it non-toxic? Where the patient's going to enjoy using it? Does it taste good? So if you go with Style Life, the answer is yes, yes, yes. They love it. And it works really very, very well. And we want to support our patients fully, improving their lives. That's what we're all in this together to do. I know you're doing that every day, and we want to help you take that to a different level. So I want to thank you very much for being on this call. And our goal is no more pathogens. We hate those guys, right? And so I'm here to help you. I would like to take any questions that you may have at this point. I'll go ahead and stop my share here.
Well, first of all, Liz, I want to say thank you so very much. What a cornucopia of information. We've gone from the beginning to the end on how well we can take care of our patients for the ultimate success of their implants as well as overall health. We really appreciate you sharing your knowledge with us tonight. I do have a couple questions that came in to me, and I wanted to see if you could share your insights. The first question I have is, can Dental Medica help patients after implants?
Absolutely. So again, if they're low on the D before the implant, you're going to have a much greater risk of that implant failing. So the bone integration is just not going to happen. But once you get beyond the surgical stage and they're healing, beyond that, if they don't maintain that level of the nutrients that they need, all the micronutrients, the antioxidants, including the vitamin D, then that will have an impact on their health. So they can use the Dentamedica taken at half the dose on a daily basis. So they should take that take a capsule with a morning meal, take a capsule with an evening meal, and that's going to give them protection around the clock so they can have all the nutrients there that are necessary to maintain health. Again, our diets aren't so great. Our lifestyles aren't so great. I started taking supplements back in the 70s, and I swear by it because we need that help. Our environment is full of toxins, the air we breathe, the water we drink, you name it, it's a problem. So everything we can do to help with that, to keep that immune system strong as well, particularly right now we're having a pretty bad flu, RSV, COVID's back, all of that, keeping that immune system viable, you really need to have those nutrients there. So the Dentamedica is wonderful for that, and it does get absorbed. So I know people that know about vitamins will say a lot of them just end up in the septic system. They just pass right through your body. So you don't want to waste money on something that's not going to be absorbed. And these are actually very affordable.
Great to know. And I have another question. How are offices offering the salivary testing? What's the protocol for that?
So offices do it different ways. The best way to do it is when you have a new patient come in, do a whole profile with that patient. So that would include getting a saliva sample from them and explaining to them, we want to make sure that you don't have gum disease, that you don't have an infection, or if you've done that initial exam and you see that there is evidence of periodontal disease there, then you will tell them we need to test to see what bacteria is causing this because you may need an antibiotic. So they would use that again with new patients. It's so easy. With our existing patients, as we detect any disease, we should offer that to them. But again, it could be asymptomatic. So doing this on a regular basis with all our patients is really not a bad idea because you will be surprised by the surprises that you get when you actually start testing. And then once you test and then you treat, you do need to do a retest to see what the status is after the treatment, to see if you got it all basically, so that we can keep that patient in remission. So that's the best way. And then retesting on a regular basis. So if some patients will, or some offices will just do a test once in a while when they see there's a need. And that's another way that some offices are doing it. But if we really want to manage the biofilm, we just need to have that awareness. And the only way you'll know is by testing.
Well, that makes a lot of sense too. Couple more questions. What makes your probiotic different, and how long would a patient take it?
So the probiotics, our probiotics are a spore probiotic. So that means that the gut capsules will actually survive the stomach acid, and you don't need to refrigerate it. So what's different is the number of species that are there. There are a lot of probiotics on the market. Some of them can be very, very expensive. And these could be pricey, but they're not. We've kept the price point really low, so they're very affordable. But again, with the addition of the oral lozenge as part of that, we're able to really ensure that oral microbiome is healthy as well. And that's going to affect the gut microbiome. So they should take it all the time because we need this daily. Probiotic foods such as kimchi, yogurts, all of these other types of foods, we should have those in our diets as well. But we're not really getting many prebiotics in our diets because those are like tubers, root vegetables. You know, when you see skulls from ancient civilizations, you see that their molars are all worn down because they're like chomping away on these root vegetables. And that's where you're getting the prebiotics to actually feed the probiotics. So this is where we have that included, and the postbiotics as well, which are byproducts of the metabolism of the bacteria that are also beneficial for us. So we've included all of that in the formulation. So it really kind of covers all the bases to make sure you've got a healthy gut and also the healthy oral microbiome.
That's a really a very forward-thinking concept as well, that we're looking at the whole host, not just one part of it. So
And
that's really great information.
the lozenges taste like fresh strawberries. It's a crazy thing. So just don't have more than one at a time.
Okay, last question I have is, how can offering products in the dental practice be beneficial? What are the advantages of being able to provide that to patients?
When we dispense products, it's so great because we're really taking full care of our products, of our patients, I'm sorry. So as a patient comes in, for example, if they're in pain, we can dispense after we treat the issue, if we're doing an extraction or whatever, they may be uncomfortable afterwards. So we can provide something for them. So we can give them the Stella Life gel, which provides analgesia within 2 to 3 minutes that lasts up to 3 hours, also accelerates the healing. You know, if patients come in with aphthous ulcers or angular cheilitis, we can dispense these products to them. I mean, we can always tell them to go online and get it, but if someone's in pain, you know, we don't want to tell them to go online. We want to give them something that they can use right away. So it's a convenience for the patients. It's also a great profit builder for your practice. So as you dispense, you have profitability. With Stella Life, you always get the bulk pricing. So there's a 30% off of the retail for our doctors as they purchase by the case. So that's great for the business as well. But we know that having patients come in to get products that are dispensed from the practice, statistics from studies done with any businesses, not just dentistry, but when your customers or your clients come back to your office, the more often you see them, the more of your services they're going to buy. As you develop that relationship, seeing them more frequently, they start having more conversations about, maybe I should get an implant, you know, instead of getting another bridge. So this is going to help to get more case acceptance as well. But it's really a service for the patients, so they don't have to run around and get things anywhere else.
Well, I just can't thank you enough, Liz, for your knowledge, for your experience, and most of all, your presentation tonight was amazing. Really appreciate you so much.